Thank you. It's almost 6:17, and as we continue to see coronavirus cases drop across our state and more people get vaccinated, one thing that could derail our progress, COVID-19 variants, as we see new variants continuing to pop up, Nick.
That's absolutely right, Kaylee. The ABC15 Health Insider team taking you beyond the headlines this morning and giving you expert advice from medical professionals and answering the question, which variants do we need to worry about here in Arizona? Before we start talking about variants and why they pose such a threat, we first must understand how variants are formed. So we turn to our ABC15 Health Insider, TGen epidemiologist Dr. David Engelthaler.
A virus is essentially like all living things. It evolves in a way that it picks up mutations. Once it replicates, it's got to replicate that entire genome. And the genome of the virus is 30,000 letters long. And so it's got to replicate all of those over and over and over, and it's going to make mistakes. And it does have an ability to correct some of those mistakes, but sometimes it doesn't. And those mistakes can act just like typos. Most of those are just typos. They don't really change the nature of the virus at all. They don't cause any harm, doesn't make the virus more virulent or anything like that. Every once in a while, you get a typo that actually changes an amino acid, which is part of the protein. And then that means that the virus changes just a little bit, that it might make it spread more quickly or more infectious in some people.
And that's how variants like the ones from the UK, South Africa, and Brazil are formed. But these COVID-19 variants are surprisingly nothing new.
One of the things that people don't realize is that these variants have been happening since really the beginning of the pandemic. In fact, when we first saw those cases in Italy, that was so devastating early on in the pandemic last year, that was because a new variant had popped up there and was just spreading like wildfire. And it took over most of Europe and it came to the Americas. That variant is the one that we've seen mostly here in Arizona and throughout pretty much most of the Americas. We've been hit by these variants that can be almost like super spreader viruses. They're supercharged and they move really fast. So it is important to know, are we dealing with something that is more slow moving that we can get our arms around, or does it really get out of control fast?
What sort of trends with variants are you noticing currently here in Arizona?
The good news is that we haven't really been taken over by the major variants of concern. We do have a few instances of the variant that came out of the UK, but we are seeing a variant that popped up in California a couple of months ago and is now the dominant strain they see in California. It's becoming more and more prevalent here in Arizona. And in recent analyses, we're seeing it in 5-10% of our cases. So we know that that's growing and becoming more important here.
How concerned should we be right now about these variants here in Arizona?
We should be concerned in that the virus is likely evolving to a way that it spreads even faster. As we get more and more people that have immunity, either because they got sick from it or because they get vaccinated, finding the next person to infect becomes harder. And the virus itself needs to kind of keep up with that. So it becomes more infectious. And so it's going to find the cracks. It's like water. It'll find the cracks in the system. The people that are still susceptible and not immune to the virus. So it's important for us to track how much quicker are these strains getting at finding the next person. And we all got to keep our guard up still.
Yeah, I love that analogy about water. It really just drives it home. Now, Dr. Engelthaler says eventually COVID-19 could become less dangerous and maybe act like the common cold where it spreads easily, but the symptoms and side effects are more minor, right? That's the hope, at least.